I was so swollen. My feet were 3 times the size of normal. My hands were swollen. I couldn't walk. I couldn't hold a fork to eat. And I was in so much pain. Something had to be done. Hi, my name's Karen Phalin, and I'm a patient of Elyse Blackston's at the Rheumatology Department.
Hi, I'm Elyse Blackston. I'm a nurse practitioner here with Memorial Health System, and I work in rheumatology. I've been here in rheumatology for about 5 years.
I was seeing my primary doctor who ran all kinds of tests for things, trying to figure out what was going on. And so I called, and they scheduled me within a week with Elyse.
Well, the first time I saw Karen, she came in, you could tell she was in a lot of pain. She had a lot of swollen joints. Sometimes when patients come in, they're not as typical presentation as she was, where they have as much joint swelling and pain. Sometimes it's a lot more subtle. So in Karen's position, we acted very quickly to get her started on some steroids to help alleviate her pain right away. But then we also wanted to go ahead and get a good workup and get started her on some other medications that she would be on long term.
After seeing Elyse the very first time she seen me, she knew it was rheumatoid arthritis. She put me on prednisone, and within a few days of being on the medication, my swelling went down and the pain was reduced a lot.
One thing with the health system here is that we have the Marietta's specialty pharmacy available, which a lot of health systems don't have a specialty pharmacy. So us having access and direct contact where we can call and talk to someone and they can message us right back on our instant messaging or phone call, either one, made it very helpful to get her access to these specialty medications quickly.
You couldn't ask for better people. The girls in her office are all awesome. You couldn't ask for better care. She's very personable. She takes her patients personally, and they're not just a number to her.
I don't feel, I'm any different than they are. We're both human beings. We're on the same level, and I'm just here to provide access for treatment for their health problems. So a lot of times when people come in, they might have multiple complaints, and it might not be necessarily a rheumatic condition we're treating, but I try to take the next step and at least get them to the appropriate person or help them figure out what is going on, whether it might be a rheumatic issue or not.
Elyse is a friend. She's not just my rheumatologist. And, I think the world of her.
Karen, she's a wonderful patient. She's had a lot going on health-wise, so it was really nice just to see her after getting on treatment and see how much better she's doing. It was very satisfying for me to know that I was able to help her when she was so, just having so much pain and so much joint swelling, and we were able to do such a big, quick turnaround and get her back to doing the things that she wanted to do. So that was very fulfilling as a provider. And I think that's one of the reasons why I like rheumatology so much, is because we get people that come in with these health problems that nobody else can figure out, and we're able to help them get a diagnosis and get treatment without having to go clear to Columbus or Morgantown. They can do it close to home. And a lot of times these people have had pain for years before they get to us. So, we're able to get them on some medicine and give them their life back.